Okay, so welcome to the information session for the Exploring Healthcare program. So today I'll be sharing more about the program, and we're also joined by three fellows who you'll learn more about, that they're an important part of the program, and alumni who will share about their experiences, what it was like for them to participate in the program. So first, I want to introduce myself. My name is Rina Yamashita, and I'm the director of the Exploring Healthcare program. So a little bit about me. I was born in the US and raised in Japan, Singapore, and the Philippines. So cross-cultural exchange and international education is something that's very important to me, personally and professionally. I have an undergraduate degree in biology and environmental studies, and I have graduate degrees, a master's and a PhD in education. And I am passionate about designing learning experiences that foster personal growth and cross-cultural connections. So I view the Exploring Healthcare program as an opportunity to help aspiring healthcare professionals grow and make new friendships across different cultures. And in terms of hobbies, I love reading, traveling, having long one-on-one chats, word puzzles, and spending time with my young son. So that's a little bit about me. But let me tell you now more about VIA. So VIA is a small international education nonprofit organization that was founded in 1963 at Stanford. And we started by sending American students to Asia to volunteer in Asia. So VIA used to stand for Volunteers in Asia. So that's our origin. But starting in 1977, we started offering programs for students from Asia in Silicon Valley. So ever since the late 70s, we've been sending Americans to Asia, mostly Asian countries, and then Asian students to the US. And now we are an independent nonprofit, so we're not affiliated with Stanford anymore, and we offer experiential learning programs in Asia and Silicon Valley. We have 7 current staff members. We're all remote, meaning we all work from home all over California, from San Francisco to Los Angeles. And we have over 10,000 alumni from around the world, with over 27 nationalities represented primarily from the United States and East and Southeast Asia. And we do global exchange. So our programs are based in the US, Indonesia, Japan, Myanmar, Thailand, Vietnam, and online. So we didn't used to have online programs, but with the COVID pandemic, we started offering online programs as well. And so the Exploring Healthcare program that I want to tell you more about today will be held online in March. Okay, so just an overview of the Exploring Healthcare program. So it's a program that brings together future healthcare professionals to explore issues related to culture, society, diversity, and innovation in the context of healthcare. It was started in 1996. So we're celebrating 27 years this year. And it started in collaboration with 2 universities in Tokyo, Japan, the Tokyo Women's Medical University and Tokyo Medical University. They reached out to VIA to organize a program where students could learn more about healthcare in the US. And since then, we've expanded it to students from any medical school or anybody studying health-related fields. And so we have over 800 students during the last 27 years from around the world join the program. And so pre-COVID, we used to do this program in person, but with the pandemic, we've done virtually. So the upcoming program in March will be held online, but we will resume our in-person program in the summer in August in Silicon Valley. So now I want to share with you the 5 learning objectives for the EHC program. One is to critically examine different healthcare systems. So during the program, you'll have a chance to learn about healthcare systems and how it works in the United States. But because the participants come from different countries, it's also an opportunity for participants to learn from each other and how their healthcare systems work in the various countries. Another learning objective is for participants to gain insights from a wide range of healthcare professionals. So during the program, there will be presentations and panel discussions featuring a variety of healthcare professionals, from physicians and nurses to social workers and bereavement counselors. Those are people who specialize in counseling for people who are in grief. We also have chaplains. Chaplains are people who provide spiritual care. So you'll get to hear from a wide range of healthcare professionals during the program. Another learning objective is for participants to discuss the intersections of healthcare and social issues. And in particular, we'll use the COVID-19 pandemic as a lens through which to explore the healthcare and social issues. And another objective is to explore unique medical issues faced by patients from diverse backgrounds. And last but not least is to reflect on your personal and professional goals and expand your network. My hope is that the relationships that you build during the program will last a lifetime. And the healthcare professionals that we invite during the program, many of them are happy to share their contact information. So you can be in touch with them and continue to build that network that you begin with this program. So what does a day of virtual EHC look like? So this is like Asia, Africa time, but basically at the beginning of the day in the morning, we'll have energizers and icebreaker activities, and then we'll have guest speakers present or do panel discussions. And then in the afternoon, we'll have small group discussions and reflections. There's a group project component. I won't say too much about it right now, but there's enough time during the program hours to complete the project so that you don't have to worry about doing it outside of the program hours. And then in the evening, so this is on your own time, you'll do individual reflections and preparations for the next day on the online platform. So reflection is a critical part of the program because every day you'll learn something new. And so both during the discussions and individually, you'll have a chance to reflect on what you learned. And so who are the guest speakers and what topics? So we do have a variety of physicians who will join us, including from family medicine and anesthesiology, gastroenterology, and other disciplines. We will also be joined by current medical students at Stanford and other medical schools in the US. So typically on day one of the program, we will be joined by American medical students, so you can learn more about how medical education works in the US. And then we'll be also joined by service providers and beneficiaries. So that means we'll have organizations come and share what they do around healthcare. So Donor Network West is an organ procurement organization that organizes a panel on organ transplantation. So you'll have a chance to hear directly from organ recipients and donor family members. So that's just a sample of topics. And this is a sample schedule, so it's not necessarily that this will be the exact schedule for the spring. But day one, medical education, small group conversations with current medical students and residents from top schools, including Stanford. Day two might focus on healthcare disparities and the response to COVID-19 in the US. And we'll hear from professionals who have worked in organizations, including the US Federal Emergency and Management Agency, and learn about their on-the-ground response to the pandemic. Day three might be work-life balance among healthcare professionals. So you'll have a chance to learn how physicians who work at various hospitals and institutions manage and balance work and life. Day four might be organ transplantation. where you'll hear stories from organ recipients and donor family members. Day 5 might be a panel on complementary and alternative medicine, where you'll get to hear from a variety of healthcare professionals. And mental health might be day 6. And then day 7 might focus on palliative and hospice care. And so again, this is a sample schedule. So the final schedule has not been determined yet for this March, but I hope that this gives you an idea of what we might cover during the program. So fellow groups. So this is a really important part of the program experience. So if you decide to apply and join the program, you'll be assigned to one of 3 fellows, and the fellow will help with a variety of things. So in small groups of 3 to 6, the fellow will help you reflect on the day's activities, share ideas, and summarize key insights. The fellow will help you strengthen networking skills by writing follow-up emails to guest speakers and panelists. The fellows will help you with practicing speaking and discussing a variety of topics in English in a small group setting. So many participants who join the program want to join because they want to improve their English skills. And then the fellows will help facilitate icebreakers and games. So there will be plenty of time for you all to have fun. And then having fun and build friendships. Like I said earlier, my hope is that the friendships that you develop during this program will last a lifetime. And so, and especially because this is a unique opportunity to form friendships across countries and cultures. So with that, I want to introduce you to the fellows for the Spring 2023 program. So we have Akihiro, Kelly, and Stephen. So let me briefly stop sharing my screen, and I'll turn it over to Akihiro first. You can quickly introduce yourself. Oh, you're on mute, Akihiro.
Oh, I'm sorry. Okay. Hi, I'm Akihiro Hara, a final year medical student at Kyoto University, and I'm really waiting for you to join this program. Thank you. Yes, actually, I went to a hair salon yesterday, and I wanted to cut my hair at this line, but he cut it at this line. Yeah, so yeah, it may be different from the picture, but I'm Akihiro Hara. Yes, thank you.
Thanks, Akihiro. And then next we have Kelly. Kelly, would you like to introduce yourself?
Hello, I'm Kelly. I am a 4th year neurobiology, physiology, and behavior major at the University of California, Davis. I wasn't a past participant, but as a fellow, I'm super excited to be working with y'all and for all like the conversations and perspectives and knowledge that we'll gain from this program. So yeah, I look forward to meeting everyone.
Thank you, Kelly. And then last but not least, Stephen. Would you like to introduce yourself?
Hey everybody, my name is Stephen Kakwende. I am from Zambia. I am a clinical officer and a public health student. I'm a photographer and entrepreneur, and I am so excited to be part of this session, and I look forward to working with everybody. And I mean, just get to learn a few from you, and get to learn a few from our culture. So I'm super excited, and I look forward to acting and having fun with everybody. Thank you so much.
Thank you, Stephen. And thank you to all our fellows. So we have a really great group of fellows. So if you decide to join the program in March, you'll be working with these 3 fellows. So let me go back to sharing my screen and we'll continue. Okay, so the next part is actually to turn it over to the alumni who have actually participated in the program in the past. So Akihiro, who you just met, he did participate in the program last spring, a year ago. And then we're also joined by Yuri, who participated in our very first virtual program back in 2 years ago now. And she was also a fellow for the summer 2022 EHC program. So let me stop sharing my screen again, and I'll turn it over to Akihiro and Yuri to share their perspectives on what it was like to participate in the program. So Akihiro or Yuri, who would like to go first?
Okay, yes.
Okay, great.
Yeah, I'll go first. Okay. I'm really happy to share my experience at this program. I'd like to introduce myself in short at first, and afterwards I'd like to talk about how I made this program and what this program was like at last time. Okay, so as I said to you, I'm a sixth grade medical student at Kyoto University, and okay, so I'm gonna graduate from Kyoto University this year, and before graduation, I have to take a national exam in February. So I spent somewhat hard days recently. Anyway, one of my present goals is to work as a doctor in the US, and I have been preparing for this. For example, I worked on USMLE, occupational English test, and some other things in my university lives. For the sake of time, I cannot talk about all the topics now, but I'd like to focus on this program. Okay. About how I met this program, about a year ago, I was looking for any chance of studying abroad because I wanted to improve my communication skills. However, because of the pandemic and because of my university curriculum, I couldn't find any chance of studying abroad in person. But at that time, Kyoto University recommended this program to me and by email. And this program is like an online studying abroad program, so it very fits me. I applied for it, and after having an interview with Lina, I could attend this program. So that's the way I made this program. Okay, and I'd like to explain what this program was like. In advance, I'd like to mention my English situation at that time. Actually, so I took part in this program at last spring program, so it's been a year. At that time, I was like a beginner at communication English. I was always sweating and I was too nervous to speak, to express my opinions in front of others in English. And I had not experienced studying abroad, and it had been about 2 or 3 months after starting training my English, speaking English, you know. But in this program, there was a general atmosphere, and Lina, fellows at that time, and panelists who are coming every day, are gently paying attention to what I'm going to say and what our participants are going to say, so we can take time sharing our opinions. And you can also write down your opinions in the chat box. It is cool. And so anyway, I'd like to say we can improve our communication skills at this program. And moreover, because we discuss over various topics with people from various backgrounds, so we can broaden our perspectives. We learn many problems across the world, in the US, in Japan. We can compare many things with each other. Okay, so in addition to these things, also some of you may be interested in working in an international society in the future, and we can broaden our vocabularies about healthcare fields at this program. which will be super helpful for your future careers. So in this program, in summary, we can broaden perspectives, vocabularies, and we can improve communication skills. Okay, so I'm going to participate in this program as a fellow next time. So I'm really looking forward to meeting you dear soon. Thank you.
Thank you so much, Akito, for sharing that. And yeah, it's amazing like how much you've grown and like I can tell that you're a much more confident speaker in English, and I'm really happy to see that. So thank you so much.
Through this program. Yeah, thank you.
And then Yuri, I invite you to share too.
Okay, and thank you for his very great story about Mia, and I really appreciate it. And actually, I will introduce myself. I'm Yuri. I'm a fifth-year medical student at Oita University, and I'm a former participant of EHC Spring Program of 2021, I believe. About the details of this program, I think Lina will be able to share more later. So I'd like to talk about the impact or the change I've experienced through this program. And so the biggest impact of this program is the network or friendship. And even after the program, we can keep in touch with each other for a long time, like Lina and I. And actually, I could see one of the VIA members last December in person. And it's so great, and we could have very happy time together. And the other thing I could get through this program is the great motivation to learn English. So, you know, I'm not a native English speaker, and as Akihiro said earlier, I'm also feeling very anxious about speaking English. So, but through discussion with other participants or guest speakers during this program, you know, it made me more eager to learn English. And also, VIA is a multinational team. So some came from the United States, like Kelly, and or some from Japan, like Akihiro, and some from African countries like Stefan, or some from other Asian countries like Myanmar. So it also made me, you know, feel very interested in foreign affairs, like what is happening in other countries, and what is the American medical system, you know, something like that. So my story is very short. So to sum up, by joining this program, I believe you can see that, you know, lifelong friends, and also you can get lifelong motivation. So if you are interested in this program, I really want to have enough courage to jump in, and it will be a great opportunity to learn English, not only learn English, but also build up your friendship or network around the world. So that's all from me. Thank you so much.
Thank you so much, Yuri. Yuri has shared her experience at these info sessions many times, and each time I'm so moved, and I'm really happy that you got to meet one of the participants in real time in person. And yeah, and like, you know, Yuri and I have known each other for over 2 years now, so you know the relationships can last, and I'm just so happy that we get to work like this together or continue to work together. So thank you so much. So now I want to tell you a little bit more about the program, and in case you're considering applying. So let me go back to sharing my screen. So who is a good fit for EHC? So in terms of participation requirements, we ask that all participants actively participate in all online sessions and contribute to group activities, to complete all required activities on the online platform, and to communicate in English. English will be our common unifying language. And in terms of interest and attitude, somebody who's a good fit for EHC is interested in learning about healthcare from a variety of perspectives, interested in exploring social issues in the context of healthcare, interested in cross-cultural exchange and collaboration, and want to embrace this active, brave, curious, open-minded attitude. I call it ABCO. So that's sort of the ABCO mentality that I promote during this program. So that's, if you have that kind of attitude, the EHC will be a good fit. What's not required are perfect English skills. So both Yuri and Akihiro mentioned that English is not their native language, and they're both anxious about their English abilities at the beginning. But as you can see, the program helped build their confidence. So that can happen for you as well. And you don't need to have any international experience, which means you don't need to have traveled abroad or visited any other countries. All you need is an interest in learning more about other countries and other cultures. So in case you're considering applying for the program in March, the deadline to complete the application is January 30th. So you still have some time, a little over a week, to complete the application. And then you'll be, I'll then review the application. And then if you pass that screening, then you'll be invited to an online interview via Zoom for about 20 minutes with me during the first week of February. And then you'll find out the results by February 7th. And if you are accepted, then you'll need to confirm participation by February 10th. That's the timeline. The participation cost is $900 US, which includes this roughly 3 hours pre-program orientation and English support session, along with 30+ hours of live online presentations, discussions, and interactive workshops. The fee also gives you access to an online learning platform with additional information, resources, and opportunities to connect with peers, mentorship from peers and industry-leading experts, topic-specific English resources, and opportunities to practice English in the context of healthcare and social issues. I also wanted to highlight that we do have participation funding or scholarship support in case this fee is you need support, financial support. So if you're interested in that, it's called the Enlight Fellowship. So if you apply, you can get a program fee reduction of $100 to $900. So the application will include the standard 4 short essay questions. And then if you're interested in the fellowship, you'll also complete an additional essay question in the application. And successful fellowship applicants will receive a $100 to $900 award towards the program fee. And I wanted to note that we will be resuming the in-person program in the summer in 2023 from August 6th through the 18th. And it'll happen in Silicon Valley. So if you're interested in that, please keep this in mind. You are welcome to apply to both the online program and the in-person program. The programs are different enough that I think that you can benefit from both. I also wanted to mention that moving forward, we will continue to offer that both in-person and online. So depending on your schedule and availability, maybe the online is better or in-person is better, but we plan to provide both options moving forward. So that's what I wanted to share in terms of what the program is like. If you have any questions right now, you're welcome to ask right now. But of course, if you prefer to send me an email, you can do that and you can learn more and apply here.